I'm so glad to be with you tonight, and JP offered such a wonderful introduction, but he forgot to mention that I'm a new grandmother. I'm very honored that you're here. JP's here. Thank you very much, Andrew Cernota, for welcoming me, for Di, all that Di did to organize this lovely day. To Pete Silva, who's here, and he hasn't been recognized yet. He's not here? I was not here. Okay. Okay. Mark Vincent?
Yep.
Very good. Thank you. Three former lawmakers who are here. Jim, who gave us our prayer, invocation. Jim Rubens. And Gary Lambert. Just left. Oh, well. I don't know what I said. Let me just begin by saying I've been to New Hampshire many times on this mission, and I so appreciate your warm welcome again. As you know, last year I came quite a few times to encourage the presidential candidates to make a commitment to repealing the Obama health law. And now we have an enormous opportunity, because we can make the 2014 midterm elections a referendum on this law.
Absolutely.
We had hoped the 2012 would be, but voters got distracted by other things. But now, 2014 can be our opportunity not only to get rid of this law, but also to regain the confidence of our nation, because our values, our Constitution, our freedoms are under assault. This is a critical time. So repealing this law will play an important part in regaining our freedoms and our strength as a nation. And there's another reason that I'm eager to talk with you about this law tonight, because the mistake is being repeated. You know that old saying, fool me once, right? Well, in 2010, the American public certainly got bamboozled when they saw Congress rush through this 2,572-page bill without reading it, right? And now all the nasty surprises in here are coming to the public's attention, and really in a very painful way. But in Washington, D.C., the lawmakers are repeating the same mistake. They're rushing through what Chuck Schumer calls comprehensive immigration reform. Comprehensive, that's a synonym for unread. That's what comprehensive means. And Chuck Schumer says, well, the only way we could do an immigration bill is to put everything together in one bill, because otherwise, if we tried to pass individual bills, one interest group or another would be feel excluded and be worried. Well, he's got a point, except that with this comprehensive bill, all the interest groups were at the table except one. Yes, yep. Joe Citizen, right? And so I'd like to, at the end of our conversation tonight, I'd like to discuss the immigration bill as well, because my firm belief is that members of Congress should pass bills that are 20 pages in plain, honest English. Amen. And 20 pages ought to be enough, because the framers of our Constitution created the entire federal government in just 18 pages. Right? So 20 pages in plain, honest English. But let me begin with this health law. This law lowers your standard of care. It puts government in charge of your care. And it takes away something as precious as life itself, your freedom. Let me just describe briefly what it actually says. Can you all hear me? I probably don't need this. This law says that beginning in January, you must have the one-size-fits-all government-mandated insurance coverage. When you go to file your taxes, you're going to have to attach proof that you are enrolled in such a plan, and you will have to provide your plan's name and your policy number. Now, in exchange for providing that information to the IRS, you will be shielded from the penalty. But you will have surrendered your medical privacy and your medical freedom. Because Section 1311 of this law, for the first time in history, empowers the federal government to dictate how doctors treat privately insured patients. So even if you have Aetna or Cigna or WellCare or Blue Cross or any of those private insurers, and you paid for the plan entirely out of your own pocket, Kathleen Sebelius, the Secretary of Health and Human Services, is still in charge of your health care. Section 1311 of this law says that insurance companies can pay only the doctors and hospitals that obey whatever regulations she produces in the name of, quote, healthcare quality. Well, that could cover absolutely everything. When a cardiologist chooses a stent versus bypass, when an OBGYN decides to do a cesarean or a sonogram. Your doctor will have to enter your medical history and your treatments into an electronic database. The goal is one nationwide database where every patient has a page. Your doctor's decisions will be monitored for compliance with federal regulations and with an eye on reducing the amount of care you get, even when you're paying for it yourself. And ultimately, doctors may have to choose between doing what's right for their patient and avoiding a government penalty. There's an irony here, too. Because I remember that for decades now, the women's rights groups have gone to the barricades to prevent the federal government from seeing their medical records or dictating to their doctor, all in the name of choice, but only the right to choose one thing. How can it be that a woman has the freedom to choose an abortion, but not a hip replacement? Amen. That is shocking. Now, when the president was campaigning, he promised that he was going to reduce the cost of health care, make insurance more affordable, right? He was going to solve the problem of the uninsured by making health insurance more affordable. Remember that? Well, that's not what's happened. You've already gotten your double-digit premium increases in the mail. And just last week, the Ohio Insurance Department announced that in January, individual premiums in the individual market will go up 88%. In California, 51%. So that's clearly not what this law does. It does not lower the cost of health insurance. In fact, the primary way that the uninsured are covered in this law is the expansion of Medicaid. That's a very hot issue right here in New Hampshire, and I hope we can discuss it, because the promises that the federal government has made to cover the cost of incrementally adding more people to Medicaid in New Hampshire and other states, it's just a farce. It's never going to happen. Every single deficit reduction plan in Washington, including President Obama's, withdraws that promise. Every single one recommends that that promise, the federal government will pay 100% and then 90% of the cost of expansion. Every single plan says we've got to eliminate that promise. So what will happen in states? Medicaid is already a third of most state budgets, right? And when Medicaid is expanded and then the federal politicians break their promises, as they always do, right? You won't have enough money for roads, for schools, for other basic functions. It will be the destruction of state governments. And then they will come begging to the federal government to do more and take over more authority. It will be the end of federalism. So beware of that promise. And remember that when Medicaid is expanded, you pay for it 3 times. You pay for it as a federal taxpayer, you pay for it as a state taxpayer, and you pay for it a 3rd time when you pay your own private premium. Because Medicaid, of course, shortchanges hospitals and doctors. And in order for doctors and hospitals to keep their doors open, their businesses going, they have to shift those costs over onto the private payers, and your premiums go up even more. It's one of the major reasons premiums are going to shoot up so much this coming year. But the most important aspect of the Medicaid expansion is how it's paid for in the law. This law expands Medicaid by eviscerating Medicare. Cuts to Medicare pay for over half this law. Think about it. Cuts to Medicare pay for over half this law. $717 billion less money to take care of seniors over the next decade than if the law hadn't passed. The average senior will get $1,431 less care per year than if this law hadn't passed. But that kind of average is misleading because only 1 out of every 5 seniors goes to the hospital in a particular year. So the year you go, you're going to get $9,000 less care than you would have gotten. And how is it being done? Well, the biggest cut is to what hospitals are paid to care for seniors. Hospitals are going to get $247 billion less money over the coming decade. What will that mean? Well, hospitals are going to be forced to lay off nurses. That's what they always do when they have less money. Lay off nurses, spread the nursing care much thinner, and that's going to have an impact on all patients. When you push that button for pain relief or for help, you're going to wait longer because there will be fewer nurses on the floor. In addition to the across-the-board cuts, Section 3000A of this law awards bonus points to the hospitals that spend the least per senior. Think about that. Is that a race to the bottom? Right. Now, I wouldn't take my beloved dog to the vet that spent the least per animal. So why would I take my mother to the hospital that spends the least per senior? We have an enormous amount of data. And it's published in the Annals of Internal Medicine last year, that shows that the hospitals in the bottom 5th for spending per senior have much higher death rates from pneumonia, from heart disease, from heart attacks. Seniors don't do as well and make it home again in those hospitals. And here, this law is incentivizing all the hospitals to imitate the lowest spending hospitals where the death rates are the highest. Is that shocking?
It is shocking.
Terrifying. And when they consider how much is spent per senior, they include the 30 days after the senior is discharged from the hospital. So hospitals get penalized for recommending outpatient rehab after you've had a knee replacement or a hip, or even a return visit to your cardiologist. Hospitals are penalized for all that care as well. Now, one of the reasons I wrote Beating Obamacare is to just give all of us a roadmap over the next 18 months, things you can do to protect yourself till we repeal this law. And let me go through just 5 of them that I think are critically important. The first is, talk with your doctor about keeping 2 sets of books. Because we all confide things to our doctors we wouldn't tell anybody else. And yet, in this new system, thousands of eyes will see that information. Advocates from the far left all the way to the far right, all the way from the New York Civil Liberties Union to the Goldwater Institute, pressed Kathleen Sebelius very hard for 2 years to issue privacy regulations that would guarantee that patients know their most private issues will be kept private. Finally, in January of this year, she published the privacy regulations in the Federal Register. And you know what it said? If you really want privacy, pay cash.
Wow.
Whoa.
She had considered the magnanimous offer of telling patients that they could have a report afterwards on who's seen their records. Now, a little late, right? But they decided against even that. So that's number 1. Number 2, if you are a baby boomer, line up your doctors now, your internist, your cardiologist, even if you're healthy. Because if you wait until you turn 65 and go on Medicare, you will not be able to find a doctor willing to take you on as a new patient. Doctors are going to be paid less to take care of seniors than any other kind of patient. So line up your care now. If you're going into the hospital and you know it for elective surgery, cobble together enough money for a private duty nurse, at least for the first night, because you're going to see that there's a lot less care available than in the past. Really important. Well, that's the bad news. The good news is we can defeat this law. It's not too late. It is not too late. The weasels who wrote this law put all the lollipops up front. You know, like keeping your kid on your plan till they're 26. What the president, talking like a used car salesman, says, free preventive care. We know it's not free. You've been forced to pay for it up front in your premium. But he demagogued all across the nation with those early benefits. Now, Obamacare is rolling out with a vengeance. People are losing their on-the-job coverage. They're losing their full-time job status. They're realizing they're not going to be able to stay with the doctors and hospitals they always had and liked. And they're watching the evisceration of Medicare. This is our opportunity. If we can reach out to all these voters, many of them are independents, and say you must go to the polls next year and pull that lever for a member of Congress, a member of the Senate, who is committed to undoing this law. And we can do it. Just look at the numbers. We have a very big chance, a very big opportunity to take the United States Senate in 2014. There are 33 seats in play. 13 are what are considered safe Republican seats. 20 are currently held by Democrats. But 12 of those 20 are in swing states or customarily Republican states. We only have to get 6 to win the United States Senate. We can do it, and then we can get rid of this law. We're going to do it. The stakes are so high. If you're seriously ill, the best place to be is in the United States. A woman diagnosed with breast cancer in the United States has over a 90% chance of surviving it. In Europe, her chances are less than 80%. You do the arithmetic. That means she's twice as likely to die from it. And when a man is diagnosed with prostate cancer in the United States, it is not a death sentence here. But in Europe, nearly 1 out of every 4 men diagnosed with prostate cancer will die from it. And if someone in your family has what's currently considered an incurable illness, this is the nation of hope. This is where the cures have always been developed. Since 1950, the United States has won more Nobel Prizes in medicine than the entire rest of the world combined. That alone tells you why this is the fight of our lifetimes, and we're going to win it.
GrokTV.